This topic is the case against cold lateral condensation. Cold lateral condensation, the concept is that we place a master cone in our preparation, and that master cone is smaller than the rest of the preparation. It fits right there if we have done it correctly, and then we're going to use a spreader Okay, we're going to use a spreader. A typical is a D11, and basically it's a little tiny, looks like an Explorer, but it's got a little bit more taper. I believe it's about an 04 or an 02 taper. Okay, and we wedge that down in next to the cold master cone that's in there, and then we throw an accessory cone, which is roughly the size of the D11. So then we follow with an accessory cone. Okay, and then we rinse and repeat. We're going to do this, you want like 3 to 5 accessory cones before you feel like you've done the job. Really simple technique to describe. Pretty easy technique to do. Most undergrads are taught this technique to this day. I don't have a big problem with the actual fill, although a spreader is an enormously efficient inclined plane. So if you ever wanted to fracture a delicate root, just honk on a spreader. And the irony of cold lateral condensation is if you're really obsessed to do a great job and you want a very dense fill, then you're going to lean on the spreader more. You're going to tighten this thing in here and run a greater risk of that. Spreader fractures of roots are known for occurring from an apical third direction because that's where the tip of the spreader keeps coming down and jamming and widening it. Also, it's a weaker part of the tooth. Herb Schilder used to joke that cold lateral condensation is basically single cone technique with a conscience. I think that's a little bit harsh. It's not the technique of filling that I mind, aside from the spreader fracture potential. It's what we have to do to the root canal to allow us to get 3 to 5 accessory cones in there. Okay, so typical preparation was prep for lateral condensation. I think it kind of boils down to we do whatever technique we're going to do apically and midstream, and then we're going to use a series of Gates-Glidden burrs, the most popular, orifice spreaders, orifice shapers, sorry. And we can do some of this with our access burrs possibly. I like this. This is the best option because unlike Gates-Glidden burrs, which are very difficult to control, orifice shapers are going to cut a more conservative shape and a more predictable shape. Typically, we're looking at a size in the GT series, the 3512s were awesome. They have a maximum flute diameter of 1.25, so it's a little bit wider. That'll allow lateral condensation in small curved canals. And a short 17 millimeter makes that very easy to use. So instead of using 2 or 3 or 4 Gates-Glidden burrs, we just use 1 orifice shaper in each of the canals, size it up a little bit, and we've got room for the accessory cones. Gates-Glidden burrs, you're going to use a 2, a 3, and a 4. The 4 should never go more than 1 millimeter below the orifice level. That will give you about this size, 1.25 millimeters, maybe 1 millimeter 1.3. And another beef I have about Gates-Glidden burrs is they cut parallel. I can't spell parallel. They make parallel shapes. And we want to have a tapered shape coronally, okay? They make shapes like this. Here's the 4, and here's the 3. and here's the 2, and so on. So what that means is we have, here's the taper we want to end up with, because we can only draw that on the narrow parts, and all this is wasted 2 structure. Okay, here's the inside of this. Go to the inside here, all this wasted 2 structure. And this anti-curvature cutting away from the inside of the curvature in small molar root canals, that's so 1980s. Okay, we did that when we figured out that we're changing the path the inside of the curve with our current files before nickel titanium. We started doing this anti-curvature shaping so we could get bigger shapes. The trend is towards smaller shapes, and this is so unnecessary. This is such an unnecessary amount of work with very, very little reward. The way we're going to manage safety in the coronal third of the root canal is we're simply going to have as a shaping instructor a smaller shape, okay? And that's my biggest beef about lateral condensation is it requires a bigger shape than we currently need now for our best filling methods. Okay, so what are my recommendations? So to reiterate, my beef with lateral condensation is, cold lateral condensation, is that I have to overshape root canals to get my accessory points in. If I have a landed blade instrument, okay, landed blade instrument, then I can get into system-based endo, okay? Unless I finish my prep with a landed blade instrument, this is not possible, regardless of all the marketing claims that are made to the contrary. Everybody says they're system-based because they have a gutta-percha cone that says it fits the prep that this file makes. Few of them can do that. Landed instruments, what do I mean by that? If you look at a cross-section of the wire that's cut to make a file instead of cutting to a sharp point, the fluting instrument cuts a shape like this. This is the land. The width of that land influences how fast it cuts and how resistant the file is to transportation of canal paths. This is an optimization of a file so that it doesn't overcut. With this kind of a blade, a non-landed blade, when we have inside curvatures, we have severe curvatures, we're going to have cutting on the inside in the middle of the root canal, in the middle of the file. We're going to have cutting away from the curvature in the apical region. So we want a landed blade file. What's the big advantage of that? Well, if you have to do it, okay, if you don't want to warm up gutta-percha, I want you to do single cone fill with a system-based approach. This is better than cold lateral condensation and an overshaped preparation. If you use a GT, GTX, a K3, these are the primary landed blades instruments. Profile, one of the first out there. You can make a single cone obturation result that is very nice. You will have a very specific preparation. Okay. The only way you do system-based approach is you have to have the whole length of the preparation all the way up to the access cavity. Okay. A single file at the end of the procedure. One file, final shape. Never talked about. A one file final shape is a requirement of a system-based approach because if there's not a single file that makes that final geometry, if we have a different file for this part, and this part, we never know what the final shape is. If we have a single file final shape with any of these landed instruments, we're going to know exactly what the geometry is from the orifice all the way to the end. And then when we got a gutta-percha cone in there, it binds tightly at the tip, and it has it's hard to draw this, impossible, and a very consistent space here between the canal wall and the gutta-percha cone. With GT and GTX system, you're going to have total on both sides 0.1 millimeter gaps. So 0.05, smaller than an 06K file on the side of that cone, either side of the cone. So this is going to be an ideal result. If you're going to do single cone technique with a system-based approach, you're going to use a more toxic sealer. Toxic sealers are great for this because you're not going to push it out the end of the root canal. You're certainly not going to push it out into these lateral canals, most likely. Okay, if we have a toxic sealer and we have a sealer surplus, our patients are going to complain. If we do single cone technique, which is non-three-dimensional, we want a toxic sealer because there will be chemical warfare going on. This is proven by Marcus Hapasalo's classic research study showing the different inhibitions, culture inhibitions of different sealers. AH26, the one that followed, AH plus, this one is also branded as Thermoseal. These are toxic for 72 hours. For 72 hours, your patients are going to need to take serious pain meds if you use these for carrier-based obturation or any warm gutta-percha technique. If you use this sealer for single cone technique, you'll have a great chance of getting success even if there are bacteria left in at the end of the procedure, because this 72 hours may allow that to kill the bugs. Okay, so I always wondered, how do they do non-3D technique and make it work? H26, the most two common sealers are H26, the predecessor being Grossman sealer, which never stops being toxic. So what am I saying here? Am I recommending single cone technique as a fill? No, I'm not. Our obturation options dictate the shape that we need to create. Okay, if you're going to fit a standardized cone, you better make an apical stop prep. If you're going to fit a taper cone, it better be the right taper cone to fit in there, and so forth. And if you're going to do cold lateral condensation, you better crank the coronal part of the root canal open, which I'm deadly against. Remember, structural integrity issues are the primary cause of tooth loss and implant replacement. Okay, so we're going to say if our purpose that's realized during our shaping procedure is conservative coronal preps or shapes, that leaves us different options. Cold lateral condensation, really not an option unless you're going to enlarge it. I would say you have single cone, that's with landed blades. You have warm lateral, excellent way, alternative. And instead of 3 to 5 accessory cones, you're only going to need to put one backfill cone in. And I would say we need to put in here worm vertical, Schilder technique. We have centered condensation techniques. This has been shown multiple research studies to be the most effective, the most three-dimensional obturation with gutta-percha and sealer into lateral canals and accessories and isthmuses, and also happens to be the most rapid way you can fill a root canal. So this is really what I'm concentrating on. In my tooth, I'd rather have this than I would to have cold lateral condensation and an unnecessary weakening of the root structure. I'd accept this because it'd be the same small conservative shape. You would take a touch and heat with a warm posterior spreader, turn it up to about 50% power, and you're just going to condense next to the master cone, let it cool off, break it loose, throw a single backfill accessory cone. That's the auto fit backfill cones. Okay. And that's a nice transition from single cone, and definitely better than collateral. Warm vertical condensation, the gold standard for three-dimensional obturation for decades. The Schilder technique has been really made more efficient by the use of electric heat pluggers that combine the function of an electric heat carrier or a flame heated heat carrier, and 2 to 3 to 5 hand pluggers. We do all that work with just a single electric heat plugger that has the shape of the canal that we're condensing through. And the two primary methods are continuous wave obturation. That's with a System B heat source, and we just drive down through the gutta percha with a shaped electric heat plugger, and then of course carrier based This would include thermofill. This is a concept that's been promoted by Dr. Ben Johnson from Tulsa, Oklahoma. His device was called thermofill. We have GT and GTX carriers. You can buy carrier-based obturation devices for most of the file systems in the Densply network, and now from the Cybron side.